So here's a case that can demonstrate some abnormalities in the ligaments of the ankle. So if we start, we go here and we can see the anterior and the posterior tibiofibular ligaments at the level of the tibiofibular articulation. The ligaments are seen well on non-fat suppressed images because they contrast well against the adjacent fat. If you have fat suppressed images, sometimes these may be harder to see. And here you can see these can look a little bit slender, but they are intact. This is the anterior tibiofibular ligament. This is the posterior tibiofibular ligament. As we come a little further down, we can see the anterior talofibular ligament. Here is its talar attachment. Here is its fibular attachment. And in contrast to the ligament we saw earlier, you can see that it's a little bit thicker. It has got a little bit of high signal, and this would correspond to something that is a low-grade injury of this ligament. The ligament remains relatively continuous. On the other hand, if we look at the calcaneofibular ligament, we can see its calcaneal attachment here. We trace it up quite nicely and you can see it coming towards its fibular attachment. At the fibular attachment, there may be a little bit of high signal and edema, which is sometimes hard to pick up, but this does look a little bit more frayed than one would normally expect, and this would qualify to me as a low-grade injury, probably more so at the fibular attachment. Most clinicians are not looking to operate on these cases, but if they are, they do want to know if there is a fibular-sided injury or a talar-sided injury. If we look further behind, this is the posterior talofibular ligament. It's seldom injured, but it can have a normal striated pattern like this. In general, here you can see that the striations are very irregular and well maintained, and therefore this is the normal striated pattern of the posterior talofibular ligament, which is intact. If we look at the fat suppressed images more medially, we see a bone marrow edema pattern within the talus, and if we look carefully as to what this bone marrow edema pattern corresponds to, it is the medial aspect of the talus. If we start to look a little bit more closely at it, you can see that this corresponds pretty closely to the attachment of the deltoid to the talus. And if we look at these deep fibers of the deltoid, they are nice and dark. These fibers of the deltoid, which are the mid to superficial fibers, you can see look irregular and ill-defined. There's not discrete and complete discontinuity, but certainly it has lost that simple pencil-like architecture that you see up here, and this lower part does not have that. If we look on the axial images, you can again see that it has lost its normal striated appearance to it, and therefore in association with this bone marrow edema pattern and this abnormality, as is not uncommon in a low ankle sprain, which is of a higher variety, as in is a more significant variety, you can see a low grade injury of the deltoid ligament as well. Anteriorly here, this is the tibial spring ligament, and then as we come further down here, here is the calcaneonavicular ligament, which is the static stabilizer for the arch. So this would be a case which you would describe as somebody who has got a low-grade anterior talofibular ligament injury, a low-grade fibular attachment calcaneofibular ligament injury, and then a low-grade deep fiber deltoid injury along with bone marrow edema pattern at the talar attachment. And that bone marrow edema pattern, the deltoid injury, would be reasons why somebody with this kind of an injury may respond a little more slowly than a routine ankle sprain. And therefore may have led to their imaging. It's also important in this case to look at the tibiotalar cartilage and make sure that there are no cartilage defects, and then finally to look carefully at the peroneal tendons to make sure that there are no peroneal tendon splits, and also to look at the peroneal retinaculum, which you can see back here, which looks relatively continuous, and that there's no subluxation of the tendons themselves. So in this case, it would be suffice to say that this is a low ankle sprain with involvement of the deltoid ligament, which is also probably more like a low-grade injury, but this could explain why somebody is having a slightly delayed healing process from a routine low ankle sprain.